Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. We have a lot of people who are writing in about being hit. I'm just gonna, so a mom who says, my son hits me anytime he doesn't like what I say.
Right.
And this is what we were talking about before, is let's get you some help. Because that's not how your world should work, and it's not how his world should work, right?
Yeah, absolutely. And like, let me just touch on that real quickly. When you say he doesn't like what I say, that means that what he's trying to communicate is somehow something like, no, I don't want to do that, or no, leave me alone, no, I want a timeout, I want a break, whatever it is. Try to teach him that communication. And if you can teach him that communication, it will help replace the hitting, because the whole point is to help our kids communicate more appropriately rather than hitting. Remember, all the hitting is just the child trying to say something.
Yeah. Then another person has written in and says, do you have any suggestions for me? This is from Facebook. My friend's daughter, ADS, she's 11, has grown up a great deal physically. So when she has a meltdown and scratches me and my other daughter and pulls our hair, I suggested cutting her fingernails to remove the weapons and to speak calmly to find out, calmly to her, to find out why she's acting out in a way that hurts the two of us. Any other suggestions?
Yeah. So this is a really good example, and thank you very much for writing in, because I want to talk about this for a moment, and it's important for everyone. So depending, again, I will always say, you don't even try to intervene or do anything with the behavior unless you know the function. This is extremely important. In this particular case, yes, it would help for you if you cut her nails short so that when she hits you, it's not hurting you or your other child as much. Yes, no question. But the reason that she's hitting, we have to identify. If she is hitting simply because she wants your attention, then by talking to her calmly, you have now given her attention, and she is going to learn that hitting was an effective way of getting your attention. Does that make sense? I want to kind of repeat that, because
it's
that's
like
so
writing her
important.
a check and saying, keep doing that because I'll give you what you want.
That's right.
And I know it feels weird, and in a second we'll talk about the fact that I know you're getting to this, but you know, when you say don't do anything, it's hard when someone's coming at you and hurting your other child to do nothing.
Right.
But you know, there's blocking and things like that. But finish your thought.
Exactly, and that's exactly where I was going, Shannon, is that like with hitting, again, if the function is I want your attention, then the way to do this is to block and do something else, not give the attention, As Shannon said, it's extremely difficult. That's why it helps to have a BCBA on board or someone who's trained in this field so that they can kind of help you and show you what we mean by saying don't give it attention. Talking to her calmly is not going to work. Because basically by talking to her calmly, she's getting your attention. So if that's the function, you really have to identify why she is hitting you. Is she hitting you to get attention? Is she hitting you because she doesn't want to do what you told her to do? Is she hitting you because you're giving attention to the other child and she doesn't want you to do that? Like, really figure out what it is, the function. And then you want to make sure, I mean, in summary, here's what it is. Whatever the function is, give the child a better way of a more functional, a more appropriate, adaptive, environmentally, socially appropriate way of letting you know what they want. They can speak, teach them to say exactly what it is. If they cannot speak, teach them to touch an icon, teach them some form of communication that is more appropriate. When they do that, give them whatever they want, the attention, the object, escape, whatever it is. And when they hit, don't allow them to get the attention, the object, or whatever it is.
Yeah, I think when, for those of you who are writing in about these kinds of things, I want to give them something to do today.
Yes.
If you are not already with an ABA provider, I would suggest that, because I could tell you here in California, the first phone call might be to the regional center, but those kinds of things take time. Very likely you have insurance somewhere that will pay for ABA. I would tell you to call an ABA provider today and say, you know, how can I get started today? That'd be the first phone call I'd make. Then I would also call, if you have something like a regional center, start that phone call and say, I need help today. My child is being aggressive. I know that that's a scary thing to call a public health line and say because you're afraid of what you're going to trigger. But the fact of the matter is you need some help and support, and things go bad quickly.
Right.
When kids are being hit and when you have other kids that are in danger, you need help. Now is not the time to be quiet about it. Reach out, get help as
100%.
early as possible.
Definitely.
The fact of the matter is dealing it with a 3-year-old is easier than dealing with a 9-year-old, and dealing with a 9-year-old is a lot different than dealing with a 19-year-old, and even dealing with a 19-year-old is a lot different than a 45-year-old who is now institutionalized and is hitting people, right?
So right.
Okay, I'm sorry. Get off on my bandwagon. Okay.
And also I want you to know, like, it's not as bad as it is hitting you. If that frustration, if that individual, if that child is not heard, if we don't figure out what they're trying to communicate, their frustration moves from you to other people and to themselves.
Yeah.
And then when you're in your 40s or 30s or whatever, 20s, you're now injuring yourself, which, by the way, is a horrible scene as well. So please, the more important thing is to figure out the function. And that, you know, as Shannon said, get an ABA person, a behavior analyst to help you. Or if you want to do something else today, you can go on Skills for Autism. And please start filling out the indirect functional assessment. That section of Skills will really help you.
It's called the CIFA, C-I-F-A, the Card
Correct.
Indirect Functional Assessment, and you could do that today. And if you're not sure what to do, but you're like, oh, I heard Shannon say do something today, email me.
Yeah,
Email me, and I'll separate some time, and we'll find something in your area that helps move it a little bit today. Because
Yeah.
that's the thing, is that, like, it seems like you got to climb Mount Everest and you're looking at the top of the hill going, I know, because I've been there, and you get a little paralyzed, right?
Right.
But you start on the mountain.
That's right.
And then, you know, you're moving in a direction, and
And I have
eventually you get
another
there.
resource for you, which is the Institute for Behavioral Training.
Yeah.
And if you go on that website, there's a whole bunch of shorts, like 20, 30-minute online trainings on this subject. So you will go in and you'll find these modules and you'll just read what they are, and you'll find one that says, how do I deal with challenging behavior? There might even be one just on hitting, I don't know. But really go in there and you'll learn so much in 30 minutes about why the individual is hitting. It'll help you tremendously.
And they're really inexpensive. Most of them are under $10, which
Yeah.
is you know, less than what you'd go buy a book, right?
Yeah,
It's right there. Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.